We'll be talking to Dr. Omo Okwasui Igbenosa. He's a senior registrar, gastroenterology from the Department of Internal Medicine from the University of Benin Teaching Hospital. A pleasure to have you today in the studio.
Thank you.
So yesterday, July 28 was World Hepatitis Day. Yes. Tell me, why do we always have these special days for some diseases?
The World Health Organization, the WHO, deemed it necessary, saying that a lot of persons worldwide are coming down with specific ailments, and specifically for July 28 with hepatitis.
Okay.
And so it was deemed fit, amongst not just WHO, but also associations of gastroenterology, hepatology, that it should be important enough to celebrate and create awareness.
And create awareness.
For prevention and treatment. Okay,
that's fantastic. Now tell me, when we're looking at hepatitis, exactly what are we looking at?
Okay, hepatitis.
What is it all about?
Is, of course, hepatitis has to do with the liver.
Okay.
Hepatic, that's the liver.
Hepatic.
Now, hepatitis is infection of the liver.
Okay.
Inflammation of the liver.
Okay.
Now, a lot of things can cause hepatitis.
Okay.
But we are coming down to the viral causes. So we're talking specifically of viral hepatitis.
Oh, viral hepatitis.
And it stems from hepatitis A, B, C, D, and E.
Wow.
That's where our emphasis is called. It's been discovered through research.
So different types now.
Yes, of what causes the bulk of hepatitis. And so focuses on that.
Okay, so now what can we say is the cause or are the causes of hepatitis? Maybe A, B, C, D, E, thereabout?
Well, the ones that we are very particular about, actually,
the viral.
Yes, in countries like Nigeria is hepatitis B and C, which we can
okay, hepatitis B and C is predominant
A
here.
And E are more from unhygienic environments, fecal oral routes, while for B and C, especially either through unprotected sexual intercourse, blood transfusion that was not properly screened, sharing of sharps, needles, blades, what we use for the hair,
that's
and all of that,
and
yes.
All of that.
Sharing of syringes for those who are drug addicts. So this can actually be transmitted from person to person. Also, can also be transmitted from mother to child during childbirth, and even during infanthood and childhood.
Okay.
So these are the ways that it can be transmitted. As I said, our emphasis majorly is on B and C.
On B and C, which is the viral hepatitis.
Yes, viral hepatitis.
Okay, tell me, what are the signs and symptoms?
Okay, they are varied. But one of the things that can be seen in patients that have hepatitis, precisely B and C, is that a lot of people will have their eyes becoming yellow.
Okay.
Normally we see the black and the eye, the conjunctiva becomes yellow. So once that people see that, I say your eyes are becoming yellow, that could be a sign of it. So people begin to have itching.
Okay.
More often than not, it's generalized.
You know, sometimes one can just
scratch
the body.
More often than not generalized, and it's persistent.
Okay, persistent itching.
When it becomes recurrent, it will give you a sign.
Okay.
Abdominal pain, stomach pain, what we call stomach, the abdomen, actually the right hand side, right upper side, becomes painful. The abdomen becomes swollen. There could be incidents of not being able to go to the toilet, which we call constipation, or recurrent diarrhea. Those are some of the things that could be found. The swelling of the legs. Those are some of the things that can be found that will make people go to the hospital, they get screened, and find out.
You know, in this part of the world, like I often say on this program, people don't go for medical checkups, people don't go for medical assistance until it is very late. You know?
Yes.
So what are the early signs? What is the everyday thing you can just, like, signs that people will kind of just ignore? You know, there are signs that I think something will be happening, somebody saying, I beg, nah, that's no issue. You know, like, so what are those minute signs that people often ignore that can be attributed to this condition?
Okay. You know, you said something very right. A lot of persons in our climb don't go to hospital until there is something terribly wrong.
It's not our portion.
It oughtn't to be like that. In fact, that's part of the reason why we are doing this. It's also advocacy, prevention. One of the things that could be found is that there's this general feeling of being unwell. You know, this feeling of being unwell that has been there for a while. You just know that you are not yourself. The person is not himself or herself.
But just suppressing it with PCM.
Then all of a sudden you see your stomach always spinning you, usually the right side, as I said, or it gets swollen. The legs get swollen.
The right side gets swollen, or just the whole of that region.
It's more on the right side.
Okay.
So you notice that part becomes stretched and swollen. Tummy gets big. then there could be fluid inside. It gets big, you have not eaten, or you eat, after you eat just a little compared to how it used to be, you are full.
You feel bloated.
So some of the things. Then sometimes person could be having fever. As I said, it has become yellow. Okay. That one is a common thing. Others can tell you. Person might not see it.
Like jaundice or
yes,
something.
Yes, jaundice.
I was discussing with Dr. Gbenosol a while ago, trying to know that very, very minute thing that we usually ignore that can be as a result of early signs of hepatitis. All right, doctor, let's go on.
Yeah, something else we could also see from history taking. There's always a background, most times, of alcohol, chronic alcohol consumption.
Okay.
So a lot of persons who consume alcohol, large volume over time for a long period, say 2 years to 5 years, 10, 15, 20 years, gradually develop hepatitis. Now, these two, it's a background. By the time the person gets infected with hepatitis B or C, worsens the person's condition. Then comorbid conditions, especially when the person is diabetic, it's actually easier for the person to come down with hepatitis when it becomes infected with viral hepatitis. Okay. As I said, yellowness of the eyes, swelling of the legs, abdominal distension, generalized body itching. The person may be urinating and discover the urine is dark colored. That could be a warning sign that there's something wrong.
So one can easily say, oh, this is malaria.
Yes.
When the urine is dark.
Co-colors, that's how we describe it. Once that is seen, the person should seek medical help.
Okay, is it possible for children to have hepatitis too?
It's very possible.
If yes, why?
One of the ways it can be transmitted from mother to child. And in fact, it's been from research, it's been found that when children have it, it's actually higher tendency to have it higher in children. And it's because for hepatitis B, it doesn't have a cure. It's there for
doesn't have cure?
Yes, it's there for up to 30 years. By the time the person is in his early 30s, late 30s, which is the productive age of the person, that's when most times they come down with liver cancer.
Liver cancer.
But if somebody, probably an adult has it, it takes a longer time. And if the person has good health-seeking behaviors, it's able to be managed by the experts.
Is it not possible to detect it in children? Because when you just said it can be in the child for up to 30 years thereabout, and when it gets to that reproductive age, the person can just come down. Is it not possible to detect it early?
Of course it is.
Enough.
Yes.
So what should the mother look out for? Because this one that some mothers find it very difficult to go and get immunization for their children.
In fact, that's where I was going to.
You start begging them to go and take immunization that is free of charge.
Yeah,
just spend that small time to help your child. They will not go.
Yes.
You know? So
one other thing is that once a mother is diagnosed, of course, during the pregnancy, you go for antenatal. You have a lot of several clinics.
That is the ones that go for antenatal and go to antenatal in a good hospital.
Yes, in good certified hospitals. Now, once it's detected, the person is primed. The family is primed.
Okay.
Once you give birth, we must give immunoglobulin, and the baby must be immunized. And so that helps the baby to prevent it. So after then, as they come for postnatal follow-up and possibly, now refer to the adult clinic for the mothers now, they are tutored, they are taught on how to ensure that it's not passed on to either the husband or the children, not just the one that was just giving birth to. So it's actually high in children, not just from mother to child, among children too.
Among children.
And so, of course,
so how do they contract it among children?
It's, when they play, they easily get injured. It's true blood. It's true body fluids, especially true blood. Of course, we know that it's actually, compared to HIV, it's actually more effective.
More effective.
About 30 times more effective. So if a child has it and it's at the stage where you can share it, somebody else comes even days after.
I don't fear, doctor.
That's why we advocate prevention. We advocate checking. And once you do the testing and it's negative, we advocate that the person gets vaccinated. 3 doses as an adult. Yes, for children, they take it as a part of the immunization that is being given thanks to the federal government.
Sometimes immunization does fail. Because I remember at one time that somebody was complaining that, I immunized this child, why should the child come down with measles? I immunized this child, why should the child come down with this, come down with that? So why? What happens when the immunization fails?
A lot of things could go wrong. It might not be that it failed. A lot of things could go wrong. One, it's actually, most of these things are cold chain. It's possible that the cold chain was broken. And that could be a reason why it seemed to have failed. Other things could also be possible, but that is one of the things that we can hold on to. If we can be traced that it's failed, it's possible that person, the baby, the child didn't really get it. But we advocate that they get it.
Get it. Okay, you just mentioned quite a number of hepatitis A, B, C, D, and thereabout, and E.
Yes.
Now, and then you say B is not curable. Yes. B and which other one is not curable?
C is curable. B can be managed.
B can be managed, not curable.
Yes. What we do is that we give medications that can suppress the viral load, so that it can hardly be found in the blood once we do our investigations. However, for C, it's 99% curable. 99%
so
just that the drugs are quite expensive.
There are drugs to use.
Yeah, there are drugs to use. 3 months, the person is on it, and the cure rate is 99%. It's just a bit unfortunate that currently, from about 100,000 plus, it's short to over 150,000 for the medications right now. But there are drugs that can be used to cure hepatitis C. To cure hepatitis C.
Now, hepatitis A, is it curable too?
Hepatitis A,
or not curable?
It's something. It's once somebody gets it, it's an acute infection that's more often than not wears away. It comes and the body is able to mount immunity, and it's taken care of. Okay. However, for B and C, for B too, the body can mount immunity. What we do is that if we do the investigation, what we call the 5-panel test, it's in the acute stage, we wait. So the body can mount an immune response that could fight the infection, and within 6 months from when it's acquired, the body can take care of it. However, after 6 months, and we repeat our test and it's still there, it means that the body has not been able to contain it and expel it. So from then on, the person needs to be managed by a gastroenterologist for life.
Okay. You did mention that at reproductive stage, any child that have it, when the child gets to that reproductive age of life, the liver may just come down. Will it affect fertility?
I said that's the productive stage, both economically and otherwise. Not just productive life of the person. Yes, there's nothing wrong if the person wants to get married. And give birth to children. It's very possible to be able to marry and give birth. It's not. It doesn't hold back the person.
It doesn't hold back the person, yes. But the thing is that the possibility of the offspring having it is high. Yeah?
No, of course. If we check and if it's C, we treat. If it's B, we have several parameters we look at that we use to manage. So if the person wants to get married and may probably get pregnant if it's a woman or the man, whatever the case may be, of course the obstetrician and the gastroenterologist carried along, so it's safe for both couples to come together. And
I'm particularly afraid because if you go to teaching hospital, the tendency that all of this will be checked is high. But there are some other hospitals that is a one-man doctor thing. The doctor is the gynecologist, is the optometrist, is like everything.
That practice is gradually phasing away in most of the facilities. I can say for Benin and major cities in Nigeria, Port Harcourt, Abuja. Now people are tilting, even medical professionals are tilting towards specialist care. Now, okay. So even if it's a one-man business, they call in experts.
So there's nothing to fear.
When there's a gastroenterology problem, they call in the gastroenterologist to manage the patients. That's what
so there's nothing to fear.
There's nothing to fear.
We're in safe hands with doctors. I know you will say so. Now you're not a doctor. Okay, talk to us now as we wrap up the show. What's your advice to the general public? I see that you're holding something.
Yes, I just want to. We are advocating.
Okay,
this is.
No, show it to the camera. Let the camera say it.
Protect your liver. This is protect your liver, because it's essential for life.
Okay.
It's time to take action. That's the theme for this year.
Okay.
Now, the major thing is prevention. We should get checked. We advocate yearly checks. Besides other investigations, you must do hepatitis B and C. And once it is positive, once it is positive, we must see the specialist. And in this case, it's a gastroenterologist. If it's negative as an adult, 2 things can happen. Either if the person has been vaccinated previously, 3 doses, you can check the titer. However, you can take a booster dose because checking the titer is quite expensive currently in our environment. So what we do is somebody can just go for a booster dose after at least 10 years of getting the 3 doses. So if it's not up to 10 years, maybe 2 years, 5 years, no need to get a booster dose if you cannot afford checking the titer of from the vaccination that you got previously. So prevention is a key. If person has it, you must ensure you see your gastroenterologist. And for hepatitis B, you must be followed up for life.
Okay.
Now, once the liver begins to have issues, now we call it medical term, call it liver cirrhosis. Once there is cirrhosis, there's a greater tendency, higher tendency for the person to come down with hepatitis, with liver cancer. And once liver cancer comes in, now the challenge in our environment is that most persons don't come on time. Of course, we go to a lot of private places and they think it's malaria, think it's typhoid.
Okay.
Before they do ultrasound scan, a lot of time has gone and they see something before the person is referred. So once the background is hepatitis, the diabetic, takes a lot of alcohol, person is very obese, it's risk factors.
Okay, so the key word now is get tested. Get tested,
ensure that if you're positive, the person is positive, it should be followed up by a specialist. If it's negative, you must be vaccinated.
Thank you so much, Dr. Buneso, for finding time to be with us today on the program.
Yes.
We'll do this again because this 25 minutes is quite short. We'll do it again so that our people will get quite huge education. Thank you for being part of Healthy Living today. We'll see you again on Monday. Bye-bye.